My name is Tom Kimball. I came to Texas Tech to pursue a degree in marriage and family therapy. And as I went along with that, I began to do internships and practicums with a variety of different entities, people making that transition from addiction to recovery. The program I teach in is Addiction Disorder and Recovery Studies. I'm an associate professor there. I teach family dynamics of addiction and recovery on the undergraduate and graduate level. I also am the director of the Center for the Study of Addiction and Recovery. Its primary objective is to provide support for young people in recovery who are staying clean and doing well at Texas Tech's university on their campus.
We know a lot about addiction, what it is. We now know, based on decades of research, that addiction is a brain disease. And we know the mechanisms in the brain that are affected. What we don't know is a lot about recovery. And so gathering data, being able to follow people long-term in recovery becomes essential in us understanding in order for us to help more people. Addiction really is an epidemic across this country, and not enough resources have been poured into efforts to understand recovery, efforts to understand the process by which people actually stay clean, and it's incredibly important that we do that. The process in which MAP gathers data creates a tremendous amount of knowledge that we don't have. Following people on a regular basis, asking them important questions about recovery is essential in us understanding that. And the way in which MAP gathers data is really on the cutting edge of the field. The powerful thing is somebody in recovery having a relationship with somebody else, a MAP specialist, a peer mentor, if you will, that can help them when they need it. MAP does a great job of engaging family members and other people on the recovery team as part of the process of supporting the client in their 12 months, 15 months after treatment. And they do that by calling them, having them involved in the process. Now, other essential element of that is the data that's gathered. And what happens is when a MAP specialist calls a client and asks them about their recovery, you have that relationship that's already been established. And so this is not a stranger asking you questions. This is somebody you have a relationship asking you important questions about your recovery. And I think that increases the probability that you're going to get accurate data. It also increases the probability that you're going to get data over time. And it also, most importantly, increases the probability that when somebody gets in trouble in recovery, they have many people that they can reach out to for help. So to me, it's the most ethical way to gather data of this kind.